holistic healthcare, homeopathy, naturopathy, acupuncture, hypnotherapy, and other alternative forms of healthcare for overall vitality and well-being. From the Renaissance Health Center in Las Vegas, it's the Healing the Whole Body podcast. Hi, everyone. We are on with Jo Oh my gosh, Jo, say your name, please. I thought I had this down.
It's okay. It's Nontakorn, Jo Nontakkorn.
Okay, Jo Nontakkorn. But you were just telling me that Jo is your nickname and Nontakorn is your first name and your last name is?
Roongphornchai.
And you're from Thailand originally.
Yes, my parents are from Thailand. I'm from here in the U.S.
Oh, okay. Well, they just were trying to make your life really difficult in school, weren't they?
Yes, they were. Yes, they were. Trust me. Every single letter of the alphabet except XYZ.
Right. So Jo is our clinical hypnotherapist at Renaissance Health Center. And thank you for joining us today. So you had mentioned that clinical is a very key component to your title to hypnotherapist because it distinguishes you from the other hypnotherapists. And how so?
Well, first of all, thank you for having me here. With the training that I've had, in order to do clinical, we have had to have some clinical, background as well as clinical studies as well too. So it's not just approaching it from just, okay, here's a pendulum and then let's go ahead and get you into sleep and all of that. We have to know the symptom as well too. So when clients are referred over to me, the first thing I'll ask them is what brings you in? And of course, they're going to come in and they say they have pain or they have upset stomachs or they have blockages or whatever. How we approach those is we approach it from the clinical side first. And then once we gather that information, then we know which protocol to use for the hypnotherapy side.
Mm-hmm. Okay. And how long have you been doing this?
I'd say probably 4 or 5 years by now.
What got you interested in doing this too? I'm very curious.
Okay. Well, first of all, I'm somebody who enjoys knowing how the mind works. The mind has always fascinated me. But what really got me into this is I had chronic back pain.
Mm-hmm.
I have psoriasis, and I have estrogen dominance. So it seems like I have every single thing in the book. And there was no medical treatment that would work for me. Psoriasis, I was told, because for me, I have it genetically. And with genetics, they say that there's no cure for it. With my chronic back pain, I was having spasms, my muscle spasms and all of that. And it was told to me that the only solution you have is you have to live with it, or else then you got to take pain meds. And with my estrogen dominance, it was either I had a hysterectomy or I just had to bear with it and just be patient and wait until you menopause. So all of these answers were not solutions for me. Because of that, I sought out alternative. And through the alternative, I learned about hypnotherapy and how the mind would work and how your mind over body is what is really the strength of what happens and what goes on with you and how you can use your mind to heal yourself. Because of that, I went out to Albuquerque. I had some hypnotherapy sessions done there. And that's where I learned that, there's also a school there that will help you, that will teach you how to do all this. So that's what got me into it.
That's amazing. And when you say you said the mind is more powerful than the body, are you talking about like the subconscious? Do you call it the unconscious? What do you call it?
We call it the subconscious.
Okay. So explain the subconscious a little bit more and the power of it.
So your subconscious is actually, if you can just imagine, the iceberg, the picture of this iceberg, and then you see the tip of the iceberg protruding above the water. Everything else underneath, that is your subconscious. So your subconscious is actually a whole lot more than just what you see above the water, which is called your conscious. And because of that, if you notice, there are two main factors of the subconscious that puts itself to work. It's called the amygdala and your hippocampus. Now, what goes on with these is if you notice, and maybe as women, we will notice it more than men, is our emotions garner us. So you have an event. That event brings up an emotion. The emotion then determines what behavior, what is your decision, and then you create the result. So that's how the subconscious kind of takes control over what you do, what you say, what you act, and also how you feel. So for those who, I hear somebody coming to my office. So for those who have, let's say, constant stomach problems, that's probably the most easiest. Who have stomach problems, that one is because you might always be worrying about something, and then when your subconscious, the way your subconscious deals with it is, everybody's going to be different. Some people, it happens in their stomach and then it causes them to either have butterflies or have acid reflux or have constant pains in their stomach, or some people you don't eat, some people you eat.
Mm-hmm.
So these are all the resulting actions that takes part from the emotions that we allow to control us. That is our subconscious. So how do we deal with it is the mind over body is really what comes into play.
Mm-hmm.
Um, Even with medication, you know, if with medication your mind is so strong, you can take a dose, a small dose, a high dose, and you might not have the effects because your mind is so far against it, is so much against it. So that is what the subconscious does. And by being able to deal, to control, to recognize that, that is what it will do to help you and help you to change or to transform, or with the treatment, to help the treatment to go on.
Right. So when a patient comes to see you, how is it that, what is your technique with accessing the subconscious? And what can your patient expect?
Okay. So a lot of people, they come in here and then they think that, oh, I'm going to go 1, 2, 3, sleep, or I'm going to do pendulums or whatever. What I tell my patients is, the moment you leave my office, you leave the clinic, you have to be able to help yourself. So what I do is I teach them the breathing technique, and it's probably one that I will use approximately 80 to 85% of the time. Is I teach you how to calm your mind through breathing, through mainly through the breathing, and also recognizing the calm mind that you have within you. Because once you recognize this, no matter where you are, you can be driving, you can be walking, you can be out with your friends, you can even be in a meeting. And when you feel yourself and your emotions starting to boil up or come up, by applying the calm mind and the breathing technique, that's what helps it to get down, focus on yourself, reiterate, and then be able to approach what is that challenge that you have in front of you. And
Mm-hmm.
it can be anything.
So do you have like a conversation with them initially to distinguish what kind of, what are the questions that you ask?
So, to your question, yes, I do have a conversation with them. And from that conversation, it will help me to know what protocol to use. So, questions that I do ask, and the first session is going to take at least 2 hours, is what brings you in here? And I will go through things like family history, what's been going on. When did you notice your change? What was going on before the change? How is it after the change? What are the symptoms that you've been facing? Have you had those symptoms before? How do you feel? So one of the main things with hypnotherapy that enables us with our protocols is emotions. Are you ready to take ownership of those emotions? Because whatever has happened to you in the past, it cannot hurt you anymore. It's not there anymore. So with what we do with hypnotherapy is we use the emotions to take you back, to revisit, but it's not something, I mean, if it's traumatic, of course we don't have to go down that route. But it's dependent on what you're in here for, that I will know which protocol to use. Now, one thing that I do tell all of my clients is the protocol, it's not a standard protocol that is applicable to everybody. You have to be able to know what protocol to bring up, and if that protocol has to be altered within the session itself. So each session is actually customized to each client. So that's what we do with hypnotherapy. So let's say you come in today and one of your things is, I want to know more about hypnotherapy. I'll say, okay, Heather, great. The first thing that I'll do with you is, let's just practice your breathing, and it's not like meditation. So you practice your breathing, you breathe in, you breathe out, and then you allow yourself to feel whatever it is that you want to feel for the moment. Because right now we don't have a goal, we don't have anything set. So whatever is on your mind at the moment, allow yourself to just feel it, and don't think about it. Don't analyze it. Don't think if it's right or if it's wrong, because you can't do anything wrong. But the whole thing is that just let yourself go with that feeling and see what it brings out, see what comes up. It's okay if the feeling is good, it's okay if the feeling is bad. And the bottom line of the hypnotherapy is there is no judgment. There is no judgment at all. You can't do anything wrong. And let's say you come out with the worst things that you didn't want to come out. It's okay. It
Mm-hmm.
needs to be let out. But hypnotherapy is not a truth serum. So I cannot sit with you here and, try to get you to confess something. It doesn't happen like that. I cannot force you to go quacking around like a duck. I cannot force you to jump up in the air and, do mime things. I can't force you to do it because while you're in hypnosis, you are still in control of yourself, of your senses. But it's only your willingness to, let's let it go. Let's just trust the process. Let's just go with it. And knowing that you're not alone in the process. That is what the hypnotherapy is all about.
And how many sessions does it usually require for them to see a relief of symptoms and stuff?
If you do your homework, and I've had a lot of this. If you do your homework, 2 to 3 sessions, because in between each session is about a week. Sometimes it's 2 weeks in between the sessions. Sometimes it's 3 weeks. If you do your homework during that time, it will probably take 2 to 3 sessions.
Okay, cool.
Yeah, I had a wonderful, wonderful girl who was in here with me, and she had some blockages, but in between our sessions, she did her homework. By the third session, everything clicked with her, and she was like, "Guess what, Jo? I finally got it. I finally understand. I finally know how to deal with my emotions." And and it worked. Just 3 sessions. I had an athlete who was in here, and he came in with doubts. I'm not going to say he didn't. He came in with skepticism, but he did his homework in between. And after, I think it was just only 4 or 5 sessions, he was finally able to go out and be the best of his game and being the best of what he was doing and what he was playing.
That's amazing.
That's the power of the mind. I'm just a guide. So this is what I tell everybody. I'm just a guide. If I give you the tools and if you can master your tools, you don't need me anymore. Hypnotherapy is not something that you need for life.
Right.
So even like my psoriasis, I've had psoriasis since the age of 2, and that is a hell of a long time.
Mm-hmm.
I was not able to wear shorts or um, shirts with straps because you would see my psoriasis everywhere. You'd see the lesions. I was just lucky it never came onto my face, but everything from the neck down, you would have the lesions. So teenage was not an easy year for me. I've had psoriasis all the way up until probably 5, 6 years ago. So that's a long time. When they say psoriasis is genetic, it's reducing your stress, it's eating properly and all of that. The stress that they're talking about, it's not the stress that that you wake up with every morning. I'm so stressed out. Oh my God, I have work to do. I have this, I have that. And then, oh my gosh, my boss is down on me. The stress is actually subconscious stress. And the only way to deal with subconscious stress is you have to face that emotion that is garnering that stress and get it out and take care of it.
Mm-hmm.
Since that day with hypnotherapy, I have not had my psoriasis come back. I might have little flares now and then, but then it just goes away because now I recognize that it's actually my subconscious mind that's causing it. So I have the tools now that I never had before to deal with it. And once I apply my own tools, my psoriasis is gone.
That's absolutely amazing. I have psoriasis as well.
Oh no, I did not know that.
Yeah, I do. That's actually how Dr. Fau ended up getting into homeopathy because I contracted psoriasis when I was 5 years old.
Okay, I
Yeah.
had it since I was 2, and I had no idea.
Yeah. So how did you end up landing at Renaissance Health Center with Dr. Fau and his team?
Uh-huh. So most of my time I was in Thailand. So I went back to Thailand. I kind of lived most of my teenage life and whatever life over in Thailand. And in Thailand, it was when I had adenomyosis. I was diagnosed with adenomyosis, and I was told that the only way out was a hysterectomy. That was a time when my cousin got into preventive medicine, anti-aging, and all of that. So fast forward when I moved back over to the US, and by the way, I did not have a hysterectomy at all. When I moved back over to the US, I was facing severe muscle spasm. And my cousin told me, look around, find a clinic that deals with preventive medicine, and go there. So I searched, I did a search, preventive medicine, and Renaissance Health Center came up. So that's how I got to know Dr. Fau. He did acupuncture with me, and it did help to relieve my muscle spasm. He also noticed that my muscles were really, really tense. And every time he would stick a needle in, I would really tense up or I would jump.
Uh-huh.
I hate needles.
Me too. I break out into cold sweats.
And yeah, that's exactly what happened with me. He would be like, I'm gonna poke, and I told him, you know what, Dr. Felt, please, if you're gonna do it, just do it. Don't even tell me what you're gonna do.
I know, right?
So that's how I started off with him. And of course, I was his patient. I got to know him through the years. And then there was a period where I just didn't come back to Renaissance because, I didn't have any problems. I didn't have any problems at all. I didn't have muscle spasm. I didn't have psoriasis problems. I didn't have my, I was also starting, I did come back again. So I came back because of tennis elbow. And it was painful and it was hurting. And of course, talking with Dr. Fau, he was like, okay, we'll do acupuncture and we will do prolozone. So I'm like, okay, great, let's do it. So while he was doing acupuncture, I guess I was a case that he remembered. And he said, you are so much more calmer now. Are you okay with needles? And I said, you know what? Yeah, I am. I'm okay with needles. I mean, I don't like them, but I'm okay with them. And he said, yeah, you're a lot easier to poke. I'm like, okay. Well, he said, what have you been up to this past time? And I told him, well, because Dr. Fauna, as a patient, we talked a lot.
Mm-hmm.
So he knows a lot about me and my background and everything. So I told him, you know what, I did what you recommended me to do. I went to do hypnotherapy. And he said, well, how did you find it? I said, you know what? My psoriasis is gone. I don't have so much muscle spasm anymore. You can see that I'm back to you for my tennis elbow. Of course, I still have my ups and downs, and that's when he diagnosed me, and we did the test, and then it found out that, oh, I have estrogen dominance. So that's not really something that I can do with hypnotherapy because it's my hormones.
Mm-hmm.
So that's how I got to know Dr. Fau, and then that's how. And then he asked me, have you signed up anywhere with your hypnotherapy practice? And I told him, no. Actually, I was going to come and talk to you first to see if this service would be of benefit to Renaissance, because I know what you guys do, and I know, but if not, it's okay. So he said yes, and he asked me if I want to go home and think about it. I told him not really, because I already have my game plan ready to talk to you if you're ready to talk.
Mm-hmm.
And that's how it all started out.
Oh, that's amazing.
Mm-hmm.
And that was 3 years ago?
4, 5 by now.
Oh, okay.
Probably 5 by now. This is 2025, so yeah, it's probably 5 years by now.
I can't even believe it's 2025. You just said that. I'm like, no, it's not. Where
Time
has
just
time
flies
gone?
away. It flies so fast.
Right. So you gave me some examples of some patients that you treated. Like, what are some of the common ailments that you're seeing a lot of success with your patients?
There are a lot of those who come in with emotion problems. So the emotions are coming with IBD, irritable bowel syndrome. That is one. Another one is another one is just dealing with anxiety that they come in for. Anxiety, fear. There's also pain that they come into me for. Um, Improvements on like ability, confidence, self-confidence. So I have a lot of those that come in. um, there was once a very interesting patient who came in with neck problems, neck pain, and we found out that it was because he was always saying organ he was using organ language.
Hmm.
So organ language is like, oh my God, you know what? You're breaking my heart. Or, my God, you're such a pain in the neck. Or, you know what? Let's go do this and break a leg. The whole thing
Mm,
is that when you use these languages, your mind and your body doesn't know that you're using figurative speech, and it
yeah.
takes it to heart. Because notice, whenever you're saying, my God, you know what? You are a pain in the neck. At the same time that you're using those words, you have the emotion coming out.
Yeah. Very
So
true.
So your body then learns this emotion and pain, that's what goes on. So what does it do? Your body then says, okay, when I have this emotion, I'm going to have pain. Where does it associate the pain? It associates with the pain in your neck.
Mm-hmm.
So, you're such a neck pain. You're always a pain. Well, that's where it comes from.
Mm-hmm.
So I told him, Doc, can you find me some other word? I mean, it's frustrating. It's whatever. Can you just use some other word instead of saying it's such a pain? So he said, you know what? It's frustrating. I'm just frustrated. I said, okay, great. Go practice. Use that for the next 7 days whenever you're feeling that emotion come up, and see if it gets better. He came back 14 days later and he said, I don't have my neck pain anymore. I said, great. Don't use organ language.
Yeah. Be consciously aware of the language you use.
Be aware, yes, yes. So those are, I mean, it is a clinical symptom, and we have wonderful clinicians here who will deal with your physical. But when it comes to the mental, this is where the hypnotherapy comes in.
Mm-hmm.
So hypnotherapy does not always mean that you have to go under. You're always going to be asleep or anything. Hypnotherapy is actually keeping yourself focused on what we're doing, keeping yourself focused on what is going on with you and what are the ways around it.
Mm-hmm.
You're not suppressing it. Suppressing is totally different. You're not suppressing it. You're acknowledging it. You're saying, yes, you know what? I am frustrated. And you know what? Let's get it out. Let's do what needs to be done. And then after that, let's look at it again from a different perspective. Now let's look at it from the perspective of the adult that you are today. If you go back and you see that, what would change?
Mm-hmm.
That's what hypnotherapy is all about.
That is so powerful. We're down to about a minute
Hmm.
and of our time, and I feel like everything that you've shared is super clear and concise. Is there any final message you'd like to share with your patients and potential patients?
Yeah, don't hesitate. Don't be afraid. Like I said, I hypnotherapy is, we cannot control, we cannot force you to do things. At the end of the day, you are still in control. But be ready to face, to own up to the emotions, to take ownership of them, because once you're free of it, it's happy days from there. And
Mm-hmm.
all your emotion needs is just 90 seconds to just deal with it. Probably 90 seconds of shouting, of crying, of just being in here, coloring my walls. Go
Mm-hmm.
for it.
Yeah.
Go for it. You can't do anything wrong. But once it's out, trust me, it's out, it's clear, the relief is there, and then you can look at it with a new set of eyes.
That's
and it won't harm
beautiful.
you again.
I really like that. You can't do anything wrong. True
No.
story. Thanks for
No.
that beautiful reminder, Jo. I think we all needed to hear this at the beginning of 2025. Thanks for joining us.
And thank you for having me.
Be sure to reach out to connect with Jo and find out more how she can help you, please. This has been the Healing the Whole Body podcast from the Renaissance Health Center in Las Vegas. Visit us at iwholehealth.com. That's the letter I, wholehealth.com. Here's to a vibrant, healthy, productive life.
This has been a production from a podcast studio.